Good morning, everybody. I'm Nageshwar Reddy. I work at the Asian AIG hospitals in Hyderabad. Good morning in India, good afternoon in Japan, and good evening in United States of America. First of all, Happy New Year to all of you, the 2020. 2019, we left with bad memories. In fact, this pandemic has turned our lives upside down. Every aspect of life, economy, healthcare, social aspects, everything has been affected. Fortunately, we are coming to the beginning of the end. Several months back, when my colleague Dr. G.V. Rao, who actually structured this virtual run, came to me and told me that we are going to have this virtual run, I was a little skeptical that are we going to end Corona by January itself? Vaccines which has come, and hopefully with these vaccines coming on, we are starting to see the beginning of the end. 2020 should be much, much better for us than what 2019 was on all aspects. So when we started this virtual run, we were not sure how many would be interested. In fact, we got Hyderabad Runners Association to associate with this. We are extremely grateful to them for this, and we're not sure how many would do a virtual marathon. We are overwhelmed with the response. In fact, over 11,000 people have already registered. Many of them have finished their runs. They're sending their actually the run and time to us, and we'll put it up separately as pictures to continue. And as we come to the grand finale of this run, which is going to end, of course, over the next few hours, we have already seen that the numbers of people registering and sending in is markedly increasing. So this is, I think, one of the largest virtual run for a campaign that has ever been done, and we're extremely grateful to so many people who have made it possible for us, our donors, the industrialists, pharmaceutical companies, and so on. And we also like to thank all of you, our experts who are on the panel here, waking up very early in the morning or late in the night in the United States and staying back to be a part of this. Thank you very much. So we'll start first with our inaugural video.
China says the number of people infected by a mysterious respiratory virus has more than tripled over the weekend.
This is very, very worrying for India. One positive case of the coronavirus has been detected. It has been detected in Kerala.
That COVID-19 can be characterized as a pandemic.
आज रात 12 बजे से संपूर्ण देश में संपूर्ण लॉकडाउन होने जा रहा है.
We are in the midst of an unprecedented medical situation. The COVID-19 coronavirus pandemic has involved every person, every part of the world today. We all have to act together to see through this.
Unlock your fear of seeking medical care in COVID times at AIG Hospitals, Gachibowli. AIG has separate non-COVID emergency, consultation rooms and inpatient services. Call 040-424-4244.
Good afternoon. My name is Nageshwar Reddy. I work at the Asian Institute of Gastroenterology, the AIG hospitals.
Welcome to this webinar, which is being live telecast from the studios of Asian Institute of Gastroenterology at AIG hospitals.
What we thought at the AIG is that we will distill this scientific information into a useful form of information for our doctors all over the country.
Medicine has always been about sharing knowledge and also updating ourselves, and also about personal experiences, especially during crises like this. We at AIG have been persistently on this to update knowledge.
Hospital has created a COVID committee in which key doctors are all the members. We meet almost every other day.
The world is changing.
There is a new normal in everything that we are doing.
It is time to conquer them and live free.
కొత్త లైఫ్ స్టైల్ కొత్త హెల్తీ లైఫ్ స్టైల్కి అడాప్ట్ అవ్వాల్సిన అవసరం ఉంది.
So I think it's important to get back and understand what the new normal is.
We're all going through a very confusing pandemic. There's all sorts of misinformation about COVID and now specifically regarding the vaccine.
This is a different kind of freedom movement.
Freedom from being captive.
Freedom from helplessness.
And freedom from fear.
Let's be together.
Let's be together and campaign
For a safe and affordable vaccine.
To put an end to COVID-19.
For AIG's End Corona virtual campaign and be a voice of freedom.
I think the time has come now to flag off the virtual run, the AIG virtual run for End Corona. Again, we're extremely thankful for so many who take part in this, and thank you very much. And hopefully by the end of this hours, we'll have many more thousands also taking part in this virtual run. We have with us a very distinguished panel of people distinguished in their careers in whichever way. Doctors, educationists, industrialists, police, state officials, and so on. And we're extremely glad that they're able to join us to give us short messages this morning before we end this. And I'd like to request first Mr. P.V.S. Raju, the Vice Chairman of our institute, an economic wizard, but also a physical fitness freak, who's in medicine, I think, is as good as any advanced medical doctor, to give a short message, especially the need for vaccine at this hour. Mr. Raju.
I'm very happy to be part of this campaign, End Corona. So I don't want to say much about the pandemic, just but to remind you about the 4-pillar strategy, that is wearing masks, maintaining physical distancing, hygiene habits, more importantly, vaccinating periodically. I think this will continue, this phase will continue for another 2 years. That's what I believe as a non-medical guy. So during this long pandemic, what I observed was, with good level of fitness, either they escape this virus, or even if they're infected, mostly they came out of it very quickly. So out of all the fitness regimens, I feel running and jogging are the best forms of exercise regimens. And if you combine the running and jogging with yoga, I say yoga, breathing and stretching exercise combined form a formidable defense against any virus or, for that matter, any disease. So let me end with this quote, exercise is the king, nutrition is queen. If we combine them, you have a kingdom. So I urge all of you, focus much more on fitness than looking for medical remedies. I congratulate every team for organizing this virtual marathon, not in the real sense of the word marathon. It is 5 and 10 kilometers walk and jog, I was told. It is astonishing. 11,000 people participate in this. So I congratulate them again. Thank you.
Thank you very much, Mr. Rajgaru, for that very apt words. In fact, I think physical activity, nutrition are as important as other things in ending this pandemic. Some of my colleagues were pointing out to me that I said 2019 is 2020 and 2021, but I want to reaffirm it again that it's actually 2019. Corona started with us in 2019, in December of 2019. We didn't recognize it at that time, but slowly it spread to other parts of the world, and 2020, of course, has been a miserable year. 2021, hopefully, is going to be much better. As I said, we have a very distinguished panel of leaders here who are accepted to participate with us. We can see them all on the panel here. Let me start first with our Principal Secretary to Chief Minister, Mr. Narsingh Rao. Mr. Narsingh Rao, I hope is there. Mr. Narsingh Rao, in fact, was one of the architects of what the government is doing now. We are extremely glad that he's here with us because I think the government of Telangana has done an extremely good job in highlighting the need for vaccination. The dry runs are already over, and I think we'll be very successful in implementing this. Sir, can you kindly let us know? I know that you are a major in chemistry, but your knowledge in medicine is as good as I've been talking to you. I request you to give us a short message, especially on the need for the vaccination. I think he's connecting from probably the secretariat, so usually we have some times problems. But what I'll do is then we'll come back to him before we get back. Yeah, we are trying to see if we can locate him. Can we ask then our Director General of Police Telangana, Mr. Mahesh Reddy, whether he can come up? Mr. Mahesh Reddy has been instrumental in reforming the police in the state. Not only that, I think they have done exemplary service during this corona period. Many of them have been frontline warriors, the police. In fact, many of them suffered this disease and saved the population at large from this spreading. So they have done an exemplary service as a state police, and not only as a police, but I think as social workers. Mr. Mahesh Reddy has been responsible for putting the calm into them. The wisdom, I think, has been distilled into telling them what exactly to do, and he's now largely the person who's been responsible for this. So Mahesh Reddy, thank you very much for all you've done for the people in this state, and I'd like to give your message. Thank you.
Good morning, Doctor. Very happy and delighted to join this AIG End Corona virtual campaign run. As you all know, right from the onslaught of this pandemic, Telangana Police has been completely associated with the fight against COVID in terms of containing the human loss of life. We have been associated right from the beginning in terms of lockdown enforcement, in terms of contact tracing, tracking, providing safety to the medical workforce who have been fighting this COVID from the front line, providing security at all the hospitals, containment zones, isolation centers, etc., etc. But then in the process, our own workforce, more than 13,000 people have been infected, and we had 72 casualties, fortunately. But then it's not deterred by the threat, and then they continue to be associated very actively with all the efforts of the society, and especially the government, in bringing about an end to Corona. Now, as we all know, the vaccine has come about. Now we are about to administer. Right now, we are through the process of acclimatizing ourselves with all the protocols and ensuring that people who are authorized to take this vaccine, we are helping them to get onto the digital platform and slot, also ensure that everybody gets the vaccine as per the protocol and all slots that are given to them. At this stage, I would like to say that in the process of administration of vaccines, now many more student vaccines will come into picture. Like we have been seeing in the cyber world, many more cyber criminals immediately take advantage of every situation. Now we will also be on the top of it to educate the public, to ensure that they get the right help, they go to the right points, and then get administered where the vaccine is concerned. And if we see by our own experience, the department's experience, the physical fitness has been the key in fighting this coronavirus. All those who have been physically fit in our department, despite several thousands of people getting affected, all of them were very, very successful. I do hope and trust that this virtual run that we have undertaken is going to really help and educate large number of populations and ensure that they continue to be physically fit, take good nutrition, nutritious food. Also, the most important thing as we have seen is the moment the infection comes in, those whoever has started medicine, they have easily come out, and any delays have always affected adversely. As far as vaccine administration is concerned, we have full confidence, and this vaccine, I'm sure, it not only physically ends the corona, if not 100%, but psychological ways of living, bring about a transformation, and ensure that come back to original, not fully original, a new norm which is near to the original, and ensure that we all live as social beings, and then we lead great lives in this year 2021. And I congratulate AIG and all the hospital management for taking up this wonderful design. Thank you for giving me this opportunity.
Thank you very much, sir, for these very inspiring words. I think as the vaccination program goes on now, I think the police is going to play an extremely important role, and I know that we are secure under your leadership to have this done very well. Thank you very much. I think Mr. Narsingh Rao, our Principal Secretary to the Chief Minister of Telangana, is online now. Hopefully, he'll come on. Mr. Narsingh Rao, thank you very much, sir. I know how busy you are in these very difficult times. Thank you for sparing this time to come on to give us some words of inspiration. Thank you very much.
Thank you very much. Hope I am audible now.
Yes, yes.
Sorry for the confusion in the initial logging in. Yeah. And also hearty congratulations to Dr. Nageshwar Reddy and his team for organizing this program successfully. And it is very apt and timely. Now, now we are at the annual of vaccination, but I think large number of people have various apprehensions about this vaccine, what care one should take even after vaccination, what should be the lifestyle and things like that. I think medical fraternity, particularly the experts, need to clarify on various aspects of this vaccination and its impact and what more care one should take after this. I think from our side, the state government has fully geared up under the guidance of the government of India, how we should go about it, what are the priority people up to the last name and details have been worked out. And I think I have no doubt in my mind our entire medical and the support missionary is fully geared up to successfully start and go through this vaccination process. I wish all of you very great success in this endeavor, this time to come. Thank you.
Thank you very much, sir. Again, I'm sure that under your leadership, vaccination program is going to be extremely successful and we'll soon see the end of this pandemic. Thank you very much. We next come to another very important personality who is also in the pharmaceutical field, but also is a health freak who does marathons all over the world. In fact, he's probably the one who's done the most marathons all over the world in our country. This is Mr. Krishna Prasad Chigurupati. He's the CMD of Granules India. I request Krishna Prasad to come on to the stage live. Mr. Krishna Prasad, thank you. Thank you.
Thank you, Dr. Nageshwar Reddy, and a very good morning to you, all the distinguished panelists. Hence, definitely, that's a very happy moment for us, but cannot put our back down. All the good habits during the much better than fasting, not I've been seeing in countries like Japan wear masks. I think this is an important thing, especially sanitation. We should. And in addition, of course, physiological and psychological health, well-being are critical. Most of us have lost weight. We have become more physically fit during the pandemic. Again, I hope everybody continues to do that. And I don't think there's anything much for me to add except saying that let's not forget the good habits we learned during. Stay safe. I thank. I would like to appreciate AIG Hospitals and Dr. Nageshwar Reddy for organizing this event, and also thank him for all the work the hospital has done. Actually, for us, AIG, for my employees, it has become a second home. Whenever we needed a room, there was a room available. Whenever we needed a ventilator, it was available. We're so happy that we never had a single casualty and very, very few serious issues amongst our staff. Thank you once again, Dr. Reddy. And also, I would like to congratulate the developers of the vaccine in India. And it's a very proud moment for us as Indians that we have two vaccines, one indigenously totally developed and the other being developed in collaboration with other. Thanks again to all the vaccine manufacturers. And thank you very much.
Thank you very much, sir. I think, as you rightly emphasized, we should all be very thankful to the vaccine industry in our country, which is one of the foremost in the world. And like we always said, we're proud of this vaccine capital India is to the world. And fortunately, they come in right time now. And with these vaccines, I'm sure we'll get over the troubles. One of the areas where this pandemic is still a major issue, and where I think there's several other issues also cropping up, is the United States of America. One would have expected that they would have controlled it much, much better than us, but for some reason it's raging there. And we have somebody very important, special to us, addressing us from there, and this is Dr. Nalini Gouda from Wisconsin. Nalini is very well-known, internationally well-known gastroenterologist, very close friend of Indian Society of Gastroenterology. And Nalini, I know your experience is totally different from what we have here in our country, and maybe how the vaccination program is going on. I don't know whether you got your shot of vaccine still or not, but hopefully you can give your experiences to us.
Good morning, everyone. Thanks for having me here. As Dr. Reddy has pointed out, we did start the vaccination program. We've had at least two FDA-approved vaccines that have rolled out, both the Pfizer and the Moderna vaccines. As a gastroenterologist and doing aerosol generating procedures, I was in the top tier to get my vaccine. So I did get my first dose of vaccine, and about a week from now, I should be getting my second dose. As a lot of you have said, this pandemic has affected all of us in one form or the other. Some, they were mild, sometimes it's catastrophic, but it hit us home very hard. While social distancing and hygiene and wearing masks and all have somehow reduced severity of the disease, it's not that we have put an end to it. And hopefully the vaccines will come and save us. The scientists around the world have worked tirelessly to produce something that seems reasonable and effective. So let us do our part, continue our safety precautions that we are taking, and hopefully the vaccine will help us.
Thank you, Nalini. Thank you very much. You know that we are learning a lot from your experience, and in fact, behind the scenes, we keep consulting Nalini a lot, knowing what's going to happen there, and because we know that what's going to happen there is going to happen here, and this has been extremely useful. Thank you very much. We now have Dr. Philip Chu from Hong Kong. Philip is the president of many societies in Hong Kong and all over the world, very well-known international endoscopist, and he sent this video message to us. In fact, Philip is also very involved in physical activities. Philip, thank you very much.
Dear friends and colleagues, I'm Professor Philip Chu from Faculty of Medicine, Chinese University of Hong Kong. I trust we have been living in COVID pandemics for almost 10 months. It has critical impact to our daily life and clinical practice, initially with limited supply of PPE and lack of awareness for self-hygiene and social distancing measures. Now everyone will be putting on their masks as well as limiting our travels and social contacts. Meanwhile, we are also seeing an impact of COVID pandemics in overloading healthcare systems, delaying diagnostic endoscopy, which could potentially delay the diagnosis of GI diseases and cancers. Thanks to the tremendous effort in research from academics and pharmaceutical companies worldwide, we now have data to show high efficacy of COVID vaccine. I urge colleagues and healthcare professionals to work together and end the pandemics for better healthcare of the mankind. Thank you very much.
Thank you, Philip, for those. I know that Hong Kong has very successfully tackled the corona problem. I think your initial masking and distancing, your past experience with SARS, I know your hospital personally had a lot of experience with SARS-1, and you could overcome this very easily. And thank you very much for that message. The other colleagues from abroad who have been sending us messages, will come back to that later. But it's my pleasure now to request Dr. Ajay Kumar, the past president of Gastroenterology Society of India, who is currently the chairman and HOD of the BLK Institute of Liver and Digestive Diseases, to address us. Again, Ajay has been very active in this field. Ajay, thank you for coming early in the morning.
Morning, everybody, and good evening to some, and good afternoon. Well, first, congratulate the Institute of Gastroenterology for. Well, there are many things that we have learned this disruption, and there are 2 or 3 things that I would like to learn. I'd like to mention, highlight. Origin of the virus has shown us that a man-made virus, intentional or accidental, not talking about that. So we learn to respect nature. That's the first thing that I have learned myself. Second thing, what has told us that the human relations are a great thing, how the people helped each other, this mammoth disruption of the human race, people were starving, and how the food was distributed, and how the whole health force, the police force, administrative force has helped each other. It's and so-called so many philanthropic organizations. There's no shortage of any money, food, or anything, and that's a big salute to all of them who have contributed to that. We have to have faith in our humanity. The third thing that we have learned is the belief in science. Science, how it has responded, has also shown the negative side, but has shown the positive side, how it went on to develop the right protocols, of course, and changing the protocols, the dynamic protocols as the things evolved, and finally the culmination into the of this vaccine, which is probably like to get rid of this virus, or at least the side of the virus. So all these things have given us a new determination. I will only sum it up by saying that at the end of it, the human race has to say, "Hum honge kamyab, honge kamyab." Thank you very much.
Thank you, Ajay, for that. I think the Indian perspective also, because I think so many people were involved, and I think at this point, the AIG also would like to acknowledge and thank so many corona warriors, the doctors, the paramedical staff, the police people all over the country who have actually rallied around. And this has been very positive aspect of our country, that there's been no division, there's no states in this. It's the whole country coming together to fight this, and this is an exemplary example, and thank you for illustrating this. We now have with us also Dr. Rinaldi Lishmani. Rinaldi is one of the leading gastroenterologists in Indonesia, a very influential thinker in Jakarta, also a physical fitness freak. We'll ask Rinaldi to address us. Rinaldi?
Hi, Dr. Reddy. Hello, everybody. Good morning. Thank you very much to Dr. Reddy and Dr. G.V. Rao to invite me for this very important campaign. And I like to congratulate also to AIG, who was very successful to organize this campaign meeting. So in my opinion, that the corona from the epidemic has become the pandemic. So we know that it can attack everybody. So we can call it's everybody's virus. But the good thing about this coronavirus, that it has given a huge change of our behavior in our daily life. In terms of controlling the disease, we know that the vaccine is a good and a promising option. However, looking at early bird of vaccine result, and also we have to very cautious with vaccination. Then the people will be reluctant to do more healthy behavior. I think, in my opinion, we still have to have a good health behavior, such as routine exercise, but very good nutrition, which will help ourselves a lot, keep our and yours high level of the immune system. So I do hope that we all together in the world, especially in India, so we can fight this pandemic will be soon over all over the world. Thank you very much, Dr. Reddy.
Thank you, Rinaldi. I know you do a lot of marathons. I can see the track behind you, and thank you for doing this marathon for the AIG and Corona. Thank you very much. We next have Mr. Sudhi Plakatya. Sudhi Plakatya is the Director General of National Guards, retired recently. Again, he's a physical fitness freak, and we have him here online with us. Sudhi?
Good morning, Dr. Rao. Dr. Reddy, can you hear me?
Yeah, we can hear you. We can hear you.
I had lost communication in between.
Yeah.
Well, good morning, good afternoon, good evening, everyone. Let me at the outset congratulate Dr. Reddy, Dr. Rao, and the entire staff of the Asian Institute of Gastroenterology for organizing this, and also giving me an opportunity to meet with all of you on this occasion. Dr. Reddy, I would like to start with the experience. I met an ambulance driver during this pandemic times. He told me that he had been ferrying patients for almost about 48 hours non-stop. That was something very remarkable about the medical fraternity, pandemic health. Why I say so is that everyone has spoken about disruptions, how nations have undergone changes, how have we started to live a new norm, as they say. But this pandemic has also taught lessons that we have within us reserves of humanity and energy which can be brought out. A crisis goes waste unless we learn lessons from it. And one of the biggest lessons that we have learned from this pandemic is that we have within us those qualities where we can perform to bring society to a wonderful way of living with each other. This ambulance driver has shown that he had put in superhuman efforts. I've had the privilege of working with the National Security Guards. They are the commandos, they are the elite commandos of this country. And what distinguishes a commando from a normal person is the extra superhuman effort he brings out. This pandemic, fortunately, very, very educatively has brought out the superhuman effort of the doctors, the frontline workers, the medical fraternity, the medical professionals, the scientists, the policemen, all those people who were involved in dealing with the pandemic. Therefore, I salute every member of this fraternity, every member who's represented here in this webinar, for the superhuman effort to bring normalcy in the country, in the community, in the world at large. Thanks to your efforts, we are now round the corner. I think we have turned around. The pandemic vaccine is on the way. But one thing which we must resolve, this is a new year time, and we all have resolutions during New Year's. This is a time to resolve that the lessons learned from this crisis shall not go waste. One of the most important lessons that I have learned, and I've shared with everyone always, is to focus on your individual health as well as on the community. Health is very important. Without health, we would not have been able to sail over this and come out with it. Congratulations once again to all of you for organizing this, for spreading this message of positivity, for rising superhuman effort with superhuman efforts to face this challenge humanity faced in the century. Congratulations once again, and thank you for this. God bless everyone. Thank you.
Thank you, sir, for that very important message. I think community and health become very important, as you rightly say. And in this pandemic, where I think it's striking us everywhere, this cohesion is very important. We next have with us Mr. Dr. Amit Verma. In fact, we keep forgetting that he's a doctor because he does so much of non-doctor things in finance and so on. He's the managing partner of Quadra Capital, a very close friend, a very wise person. I think we should listen to his words of wisdom. Amit?
Nagi, thank you for the kind words. Sometimes you are beyond kindness, but thank you. Wonderful speaking to such a distinguished audience. I'll try and keep it very brief. To my mind, there are three things that I learned out of this. First is that healthcare, we all know who are on this panel, that healthcare is an economic priority. I think what this pandemic taught us is that you cannot dissociate your disease from what happens to your economic realities. I think the second thing that we learned out of this was that the public healthcare and private healthcare are not separate, and we need to coexist. So for all of us who are in the private healthcare systems, we will have to work with public healthcare, and there is no government, and we saw whether it is the United States, Europe, or across emerging countries, have put enough resources into healthcare. So if there's one hope that I have as we go forward, that we start prioritizing healthcare in our budgets. And lastly, I think we've learned that if you get hit by a disease, regardless of whatever resources, it's never going to be enough. So our focus has to be on prevention. Prevention is always going to be important, whether that's through point of care testing, digital technology, or ensuring that we provide the care, the highest quality. That going forward is going to be a priority. We all know that Corona is one of many other viruses that can strike us, and hopefully we can learn from this episode to make ourselves better. Thank you so much.
Thank you, Amit. Thank you. In fact, from here with your, it looks like you have a Narendra Modi mask on. There's some mask like coming in front of your face. So it looks like you almost put and your words of wisdom are similar to what Mr. Modi often speaks on. Thank you very much. We next have the Managing Director of Olympus Medical System, Japan, Mr. Naoshi Kikumoto, to address us. I know Japan has had a little dissimilar progress of corona than other countries, but just recently I heard last 2 days it's increasing. Mortality of 700 people I've heard recently. So, Mr. Kikumoto, thank you very much for coming on and addressing us.
Thanks, Dr. Reddy, to such wonderful event. Yes, the Japan, this week very critical. Yesterday, more than 4,000. Anyway, I have temporarily. Okay, I'm Kiku, first medical. So our company's purpose is so last year I have seen hard working but healthcare professionals. So after rain comes, we can. Thank you very much. Oh, very much.
Thank you, Kikumoto. Thank you for coming in so early for us. We next have Mr. Ram D. Sri Ram, who is the president of the Washington Academy of Sciences. He is also policy advisor to the United States, working at the NIST at the Washington. I know, Sri Ram, that now we are right in the middle of a pandemic, and Washington especially, I think, has many things happening there now. You also had a lot of occasions to interact with this corona type of situation occurring. We'd like to listen to you. Sriram?
Thank you very much, Nagi, and it's an honor to be among these esteemed participants here. And there's lots of insights that have been said, so I cannot really give you much more insights than were said before. But what I'm a slight correction. I'm the president-elect of the Washington Academy of Sciences, and you had given a talk a few months ago, which was very well received. And one of the things that was pointed out is the way that you communicated in very simple terms to a scientific audience, and that was really good. But from our perspective, I work for the federal government as a chief of the Software and Systems Division, and I come from the agency is called National Institute of Standards and Technology. It's NIST. So there's a lot of activities that we are involved in with respect to COVID-19, and it take a lot of time to go into all the activities. But you could just Google NIST and COVID-19, and you'll see the number of things. But I'm specifically involved in some activities which are associated with using artificial intelligence for providing search techniques for going through the vast amount of publications that are being generated. Again, this is all in our website. We also support the CDC in their vaccination systems in terms of the information technology aspects of it. But again, if you go to NIST site, you'll see all the measurements that we do with respect to the biological measurements, like when you take swabs, and then how do you know that accuracy of this particular measurement? Again, it's all traceable to us. So again, I work with the agency called the National Institute of Standards and Technology, and we do a lot of COVID-related work around here. In terms of the pandemic itself, I have not gone to my office for about 9 months or so, and it's been all in terms of telecommuting. But what I can say is that the kind of process that is being followed in this is pretty rigorous in terms of safety first. Everything else is next. So make sure that all our employees are safe and work in a very safe environment. And even people who need to go there have to follow safe practices. And one of the things which was propounded by Nagi several right from the beginning of the pandemic was this notion of physical distancing and wearing masks. And masks are very important. And one of the things that we did, again, you can go to our website and see the simulation, is how this coronavirus propagates when you're wearing a mask. And that will be of interest to some of you. Again, thank you very much for giving the opportunity. And I'm extremely happy to be part of this process. And I'm making sure that I'm doing my 5K run or 10K run.
Thank you, Sriram. You had your vaccine already, or when you're likely to get your vaccine?
In terms of the vaccines, the people who are getting access to the vaccines are frontline health workers, those people who work in the hospitals, and if you have special privileges. But even the healthcare workers who don't really work in the hospitals, they are in the secondary in the list. So we don't know. And interesting aspects of it is that there's a lot of technology of supply chains of vaccines going on, but we are having problems with that around here in terms of actually delivering vaccines to the public. And that's going to take it. We'll be happy if we can get it by about March, April timeframe. That is people like me. But the healthcare workers who work in the hospitals are getting it already.
Yeah, I think India in that sense is doing very well. They've organized it very well. In fact, 1 crore health workers are going to get this vaccine over the next few weeks. And 3 crores, 30 crores, I think, ultimately in the next few months. They put up 30,000 stations all over the country. Dry runs are going on. They are actually doing it like the poll we do when we have a general election. I think very well organized. And hopefully, we should show to the rest of the world that this is something that at least we can organize very well. And hopefully, by somewhere in July, August, most of the people here could, I think, like in US, will get vaccinated. Thank you very much.
Yeah, thank you.
We have with us also Mr. Rajesh Ranjan, who is the Director General of CISF. In fact, CISF keeps us safe in the airports. I think they are the ones who are taking all the risks. I'm sure many of the CISF workers have themselves developed corona, but in spite of that, they come every day. They're screening people at the airports, and I think we're extremely thankful to them. Mr. Rajesh Ranjan, thank you very much for coming on. You're muted, sir. You're muted. You have to unmute yourself. Yeah. So can you unmute yourself? You're muted. I think you're muted. Can you unmute yourself? I think we'll have to help him to unmute. Yeah. Thank you.
Okay. Am I audible now?
Yes, you're audible, sir, now.
Okay. Thanks, Dr. Reddy, and good morning to all my colleagues here in the webinar and the marathon. First of all, let me echo the sentiments of my colleague, Sudhi Plakatya. Every day we got to learn of stories of valor of people whom we somewhat disparagingly talk in terms of being average persons and the remarkable work that they did during the COVID crisis. Now, as all of us have experienced, COVID in many ways, in a somewhat macabre way, paused our pace of life and made us acutely aware of the somewhat forgotten values of compassion, community action, empathy, discipline, as well as the importance of physical fitness above all. And more importantly, it made us aware of the damage that we have done to our environment and that the damage is still reversible. So all these values we learned during the crisis. As head of the force which looks after the security of airports, among other installations, it was a huge challenge keeping our own personnel safe all through the crisis while providing security and service to our clients. So thanks to inputs from our medical professionals, we were able to get through the crisis and keep our personnel largely safe, even though we have a very large public interface at the airports and at the metros that we guard. We are certainly looking forward eagerly to the vaccine, the rollout of the vaccine. And we certainly acknowledge the role of the medical professionals who have come together in a global manner and ensured that the vaccine has come out in a record time. So thank you, everyone.
Thank you, sir. We again like to thank all the CISF for keeping us safe, especially with so much traffic now in the airports in spite of all this going on. We also have somebody from the pharmaceutical industry. I think pharmaceutical industry in India has responded dramatically to the situation, coming out with remdesivir very early, and we had an opportunity to use this. And our own experience in this institute has been that if we use remdesivir very early in the disease, especially those above 60 years or those who are symptomatic, there seems to be a fairly dramatic decrease in mortality rates. We have Mr. Joseph Gerald from the Sun Pharma. He's the Senior Vice President and Cluster Head of Sun Pharma. Joseph, thank you for coming on.
Yeah. Good morning, Dr. DN, Dr. GV Rao, and colleagues, and all a very warm good morning to all of you who've joined across the globe. My name is Joseph. I work for Sun Pharma, India's largest pharmaceutical company. And over the last several years, we've had the privilege of working very closely with the AIG team. And today, I would say it's my honor to share a few thoughts this morning with all of you. To me personally, this whole pandemic clearly has made us vulnerable, but it's also taught us that we can be capable and tide over such crises if we have adaptability and if we also become more responsible. It's also brought in a lot of, I would say, life lessons and business lessons. So I've had a lot of learnings, both at the professional front as well as on the personal front as well. I would say that we all of us need to become a little more responsible as individuals, as business organizations, as communities. And it's also taught us to reprioritize our work and lives, getting first things first. Of course, continue to be safe, we remain safe and remain responsible, and take a little more sustainable efforts so that as long as we continue to be responsible, we are also capable of tiding over such crises in the future. I wish the AIG team and all frontline workers, healthcare workers, I salute them for their efforts, and we continue to support them as we go along. Thank you.
Thank you. Thank you, Joseph. I think it's important that responsibility that we should take is extremely important, especially in a situation like this. All of us have to have a responsible behavior. And like to emphasize again, also what Mr. PVS Raju said earlier, that masks, physical distancing, and hand hygiene are still very important in spite of the vaccine. We now come to our colleagues. In fact, we always reserve the best for the last, and we have some of our very important colleagues, leaders key opinion leaders, they call them in our country, who actually make a lot of difference what they say. We'll start with Dr. T.S. Chandrasekhar from MedIndia Hospitals, Chennai. C.S. Chandrasekhar is chairman of the hospital, founder of the hospital, but more importantly, is very actively involved in many of these corona issues. In fact, a recent a cartoon that they made on corona has become very viral. TSC, you're looking very smart with your cap on. Can you give us your message?
Yeah, at the outset, I would like to thank Nagi, GV, and AIG team for this wonderful initiative. Kudos to your team. And my thought is we have come from a gloomy state to the gloomy state now. 2020 was the year of gloomy year because of the corona, and the whole world was at its knee, and because of the lockdown, economic slowdown, and human loss. But 2021 going to be the gloomy year because of the vaccine and the lessons we have learned. Human race has got a very short lasting memory. Do not take this this as more important the lesson learned from this corona period, and we should not forget it. What is more important is health is above all, for one. Number two, vaccine has arrived. It is safe and well tested. You should not hesitate to take a vaccine. So vaccine should be vaccine and not should be training. The third important message I want to convey here is, till everyone gets vaccinated, not forget the social vaccine. In terms of what Nagi said, mask, hand washing, and social distance, very important. I salute the coronavirus vaccine developers for a wonderful initiative done. And we have also created a many social initiatives. We created a Med app, an app to remind you the social vaccine, that the hygienic measures, the cartoon short film on vaccine. I will essentially follow the Nagi's footpath and taking care of this society, not only treating patient, preventive aspect and the social aspect. Once again, thank you very much, Nagi, for this wonderful opportunity.
Thank you, TSC. Thank you. We still didn't get the significance of the cap. So you wear it when you run all the time?
Yeah.
Okay.
You asked me to be very sporting, huh?
So I think I should get one now when I start. Thank you, TSC. Hyderabad Runners Association is a unique organization. In fact, one of the most active runners organization in our country. It's got thousands of members, and the second largest marathon in India is done by Hyderabad Runners Association every year. This year, we're extremely fortunate that they actually came together with us sponsoring this event. In fact, if you take the 11,000 runners that we have, many of them are coming from this Hyderabad Runners Association, true marathonians. In fact, we're getting a lot of pictures from them right now as we're downloading, as they're running, showing the timing and so on. The president of Hyderabad Runners Association is Mr. Murli Nannapaneni. I know he's going to start off his run. Maybe he should address us before this. Murli? Thank you very much. Yeah, he's actually running and he'll talk to us.
Thank you very much, Dr. Nagiri Garu. And greetings to every one of you all over the world, and warm greetings from Hyderabad. In fact, on behalf of all the Hyderabad runners, every other runner across the country, I have to sincerely thank Dr. Nagiri, entire AIG for not only been treating COVID patients throughout, talking about COVID, making people aware of it, and now getting people to get aware vaccine. I think we've had enough the whole year, and people, especially runners like us, we love to go out and run. And the coronavirus has put a damper on that free running spirit. And we have, I believe, come to the end of that, hopefully. Vaccine coming up. And this is the time where all of us need to be aware, educated, and emphasized. We need to emphasize preventive measures, and a great initiative by AIG to bring that to all of us. And what timing with the Indian Drug Administration just almost approving on an emergency basis yesterday and the day before. So perfect. I think we are at the cusp of it. Thanks. And Hyderabad runners, we are thousands of us running all across the city today from different parts. And a few Hyderabad runners across the globe are also taking part. Thank you. And We look forward to getting back to completely normal. Thanks, AIG, and thanks to all of you that have been part of this initiative. And good luck. Stay safe. Let's get
Thank you. Thank you, Murli. Keep running and send us your timing. In fact, there are two 5K and 10K. I'm sure Murli is doing 10K. All the professional runners do only 10K. It's an insult for 5K for them, but some of us are happy with 5Ks. So send us your timing. Thank you very much. We next have with us Dr. Randhir Sood. Randhir is Chief Director of Digestive Sciences at the Medanta Hospital in Delhi. Right now, Medanta is the center of, I think, the corona in North India. In fact, they have probably the largest experience there. All the VIPs there, anybody getting corona seems to be going there, and Randhir is in center of this. Randhir, thank you very much for coming on. You seem to be on an airline flight, Randhir. You're in a first class of some airlines?
No, I'm at my home because it's heavy side. I was going for my. So, but now it's raining, so can't go anywhere, can't run, can't do anything. So I'm. Thank you, Nagi, for having me. To team and TV and everybody for putting it together. I think it's a great initiative.
Keeping here and saying, I don't think it's good for us to leave. On those.
I think from some of the runners, we're getting some crosstalk. We'll just talk to them. Yeah, tell them.
Yeah. So I think the most important thing which I observed during this period was how human race evolved and how all of us evolved during the crisis. Because I think that's kind of jolt at times is necessary for us to actually look at things differently. We grew from the initial response was fear and panic, which evolved to sense of responsibility and then evolved to commitment. And that's how the entire society evolved, and particularly the healthcare system evolved. And this also jolted the government from its slumber of not investing in healthcare and realizing that healthcare is as important as defense investments. And now we know that they realize that the challenges not only come across the borders or from the skies, they also come from health issues. So this is a huge shift in the perspective of everybody. We were the hospital which was looking after, at one point of time, 100 ICU beds and about 350 non-ICU patients of COVID, and who's who of the country. And I myself was admitted for 10 days with COVID, and it is such an experience to see how these, particularly the nurses, how young girls were committed and were risks of acquiring an infection, and still they were working selflessly and very committed to helping people. And that's how I feel that the whole system evolved. This also helped each individual, look at themselves differently from the regular routine of going to work, coming back, and spending very little time with the family, to inverse system where you spend more time with yourself and your family, and then try to evolve your own self. Like I never played golf, and this lockdown period and subsequent decreased activity gave me enough time to pick up this game, and now this has become like a passion. So I think this was a great learning. Plus now with the the silver lining on the horizon is the vaccine, and I'm sure this is going to definitely contain the epidemic and put us back to new normal way of life. I think we'll not forget the experiences we had from the pandemic, and it is hats off to the pharmaceutical industry for bringing up a vaccine so early after for any disease so far. And I think that also is another evolution where, if pushed, the science can actually perform much faster than it used to perform. So I think there's lots of things we need to learn. My only area of concern remains a negative social media, campaigns against every good thing. And I think that there should be some effort not to spread negativity about vaccination, and and we should let people have vaccination. Every system has certain negatives, and we should remove them over a period of time. But it's time to be together and vaccinate as many people as possible. And the safety has already been assessed. We should not be spreading negative news about it. Thank you.
Thank you. Thank you, Randeep. Thank you. Enjoy your golf and let us know your handicap. We also have next another very important friend of ours, Dr. Dong Van Seo. Dong Van Seo is a very senior, important consultant gastroenterologist at Seoul, Korea, at Asan Medical Center. He's been the Secretary General of the World Endoscopy Organization. Again, a physical fitness streak. Dong Van, thank you very much for coming in. I know it's a little different timing for you. Korea, I think, seems to have had mixed success. Initially conquered Corona very well. Then they had some problems, and now there seems to be a small resurgence. Dongwan? Yeah, you're muted now. Can you unmute? Yeah. Yeah, you're unmuted now. Thank you.
Thank you, Nagi, and my pleasure to bring me here. Yes, Korea was relatively well cope with the COVID-19 situation before, but still, it's not completely covered. I think it is very timely and the most needed campaign at this time for AIG team to initiate this end Corona campaign. Korea was focusing on preventive measurements to COVID-19 outbreak, social distancing and mask and personal hygiene, but it was relatively effective. But it still takes very long time to completely abolish the COVID-19 outbreak. I heard that the vaccination program will start soon in India, but Korea is relatively slow in the program. It will be available probably from second semester of this year. So until that time, we need to be very careful. And my thought about COVID-19 is the year 2020 was actually through a very long and dark tunnel of COVID-19. General people as well as medical personnel suffer from a lot of difficulties, restriction, and here Korea, the government is pushing us too hard. All the social gatherings and the meetings, also the daily activities. But I'm sure it will end soon, and probably the arrival of vaccine will light. Will give the road to the end of the tunnel. Until that time, we should have a positive attitude and keep current preventive and measures. And again, I'd like to congratulate again for AIG team to initiate this timely and coronavirus campaign. Thank you.
Thank you, Dongwan. If I heard you right, you're saying that your vaccine is going to come only in the second half of this year or the first later part of this year?
The government tried to get it, but probably the first set will come at the end of February, but it will just go to the, especially the aged people, debilitated people, and the medical personnel who is working on ICU.
Oh.
So for general people, I think probably second semester.
Okay, thank you. I think this is very interesting that in Korea, you divided your medical workers also into several groups and prioritizing them to give the vaccine. Whereas here, everybody comes under the same group. Thank you very much, Dongban. We next have with us another very important personality, Dr. Mahesh Goenka. Mahesh is the president-elect of the Indian Society of Gastroenterology. He's currently at the Apollo Gleneagles Hospital in Calcutta, which also is involved a lot in COVID care. And Mahesh always has these words of wisdom to tell us. Mahesh?
Thank you, Nagi, GB, and the team AIG, not only for the innovative concept of this marathon, but also for including me in this esteemed panel. I know that whatever I speak would be a repetition because so many wisdom people have already, wise people have already spoken. But I would still like to emphasize on one or two points. this pandemic disruption we all know. And I know not only as a clinician working, but as a father, my own daughter, who is a doctor, got the corona while working in the hospital and went through a very tough time. As Randy talked about, we had to give her not only remdesivir and steroid, but also plasma. So I understand it from very close quarter as to what it means. But looking at the positive side, I don't think I have seen GV, Nagi, Ajay, TSC, Nalini so frequently in 2019 as I've seen them on 2020. Of course, on a different platform, on the digital platform. So I think initially in March, April, we thought that education will take a big, but in fact, in 2020, I think we had more educative webinars, endoscopy on air, live demonstrations than we have ever done in any year previously. So I think that's a positive side, ultimately, which has come up for the health education. So the clinical side, I think we have seen the response. And as Mr. Amit rightly said, this corona has really removed the barrier between the public health and the private health. I think this has really shown that how, not only in India, but all over the world, the private and the public health sectors have worked together. This has also, besides the corona vaccine, which we're talking about, I think excellent epidemiological studies have been done in this 1 year, which has been published. And one such study, which we just completed in Calcutta, is that we looked at comorbidities in families, and we found that 15% of the individuals in the population have some comorbidities, and this is going to help the local government in planning the vaccination schedules. The last thing which I would like to say is that we have also learned in the last 1 year that what a lot of activities we wish to do were actually a wastage of time. I think unnecessary traveling to talk to one another, to meet one another, of course, a social angle there, but a lot of activities can be done from home using various digital platforms, and that has been a big learning. And I'm sure in the times to come, even after the corona is over, we are going to adapt some of these in our day-to-day practice, both personal and professional. Thanks once again, Nagi, GB, and the team AIG for including me in this.
Thank you, Mahesh. Thank you very much for that message. I think this epidemiological work is going to be very important to decide who gets vaccination first. I think that in our country, we don't have too many of these studies, so this becomes extremely important. We next have with us another very close friend of ours, also a very eminent oncology surgeon, one of the most eminent oncology surgeons in the country, who's been the past president of the International Hepatobiliary Pancreatic Association, and again, a great thinker, Dr. Jagannath. I'm sorry, Jagannath, we brought you out of your vacation at Bangalore, but we can see the nice background. I don't know whether it's artificial or really on a beach, but it's nice to see you there.
Thank you, Nagi and GV, and greetings for the new year. But more importantly, the new way of life in the future. After a disruptive transformation of 2020, the world has rediscovered two very important lessons. Vital role of health and the power of nature. First is keep fit and healthy. That's the mantra. If a doctor is fit, he can take care of himself and his patients. The AIG virtual run, you have organized a great initiative for fitness and public awareness. I know that Nagi has a treadmill in his office. I hope he's using it well. The second lesson is respect nature and enjoy small pleasures in life. And that's the reason why I said, I want to be on the beach, and I'm sure every one of you want to be open in the beach. But we can do it, and by following the safe, normal way. My life has changed for better. Because as Randy said, I got time to pursue some of my hobbies which I always wanted to do. I'm sure your life will also change for better. Just take the 3 simple precautions all of us have talked about. That's a vaccine, not a poke in your hand. The vaccine is the mask. That's what Fauci says. And I feel that COVID-19 is a behavioral problem, not just a viral disease. Only our behavior can end the future waves of pandemic. Even if you get vaccinated, we have to change our behavior for better. And then you can be on the beach. This is a virtual beach, but certainly you can be on a real beach soon. You just follow the safe, normal way. Stay safe, stay fit, and stay healthy. And this is the mantra for the future. Not for this year, not for this decade, for the future. Stay healthy. Thank you, Nagi and GB. wonderful initiative.
Thank you very much, Jagannath, actually for coming out of this vacation and giving us this message. We next have somebody who's probably the Bhishma of our organization, somebody who has the wisdom of so many years to tell us what we should be doing and what we should do next. Dr. Somaraju, one of the leading cardiologists, not only in the country but in the world. He's been always giving us distilled wisdom whenever, and sometimes it's very on the face wisdom. And thank you very much, sir, for coming. Dr. Somaraju.
Thank you, Nagesh Reddy. The wonderful initiative you've taken. And most of the things that have been spoken are already spoken by a lot of wise people and experienced people. And some of them we knew in person. And Sudhi Plakatya has become very bold from last time I saw him to now. Really, I became bold also. So having said that, I just wanted to add a few things. Like, you know, we must be willing to look at the causes of causes. Why did we get into this situation? And a vaccine, is it going to be saver for the rest of our lives and for the rest of future of humanity? Not going to be. Because the way we conduct ourselves, that was the reason why we got into this situation. We got a disease in spite of our best technologies and science in medicine. We have no cure. We have no treatment for a disease. And then we look for a vaccine coming thanks to the technology and science again. But again, this vaccine is not going to take care of the next agent that is going to come in. It's going to come in. This is the way we are going to conduct ourselves. So the answers are not simple. But while we say this, all of you have done wonderful things to tackle it the best possible manner. When you say that we faced all this with courage and conviction, I would say it is not just doctors and nurses alone. The whole healthcare system responded. And they are like, you know, the housekeeping staff, whatnot, everybody, the administrators and clerks and everybody. So they were the unsung heroes. Again, extending the idea further, it is not just healthcare system, the police, the public health system, and the leaders in the community. That includes bureaucrats and politicians who meant well, went around while taking the risk that everybody made the present situation possible so that we could limit the damage. I would say damage, how much we could limit the difference altogether. We also learned first time how to treat a disease for which there is no treatment. And congratulations to all of you. Next time when we meet, we'll talk more. But be aware, this vaccine not going to sort out the problem we may have that is coming up again. Because as long as the Chinese don't change their dietary habits, they are going to give us more and more. And then we should be ready for it. Thank you.
Thank you. Thank you very much, sir, for also warning us about future epidemics, because we'll get better prepared with this now. And so we have our last two messages. One is from Dr. Naveen Chandra Reddy, who is the medical director of AIG. In fact, he's been the one who created all the corona care here, has been responsible, huge experience with corona patients, and we'd like him to, Naveen, yeah, Naveen is running probably. He'll, Naveen, you're on.
Morning, sir. Morning, everybody. At the hospital, I faced this challenge. Pandemic started. In April. We geared up. We have up a center for rush through creating the testing entire setup, and we geared up all our staff to care for. We really taking a call with the help of all of our, and that protocol really worked to a large extent, and we could reduce the mortality. And as we went through the process, we also had been part of vaccine trials. Two major vaccine trials are at AIG, and we have participated with Bharat Biotech, and we found that the efficacy and safety was reasonably good, and very soon we will have them in place. And we have already created a nice vaccination center here. Whenever it is ready, we will be able to provide to as many people as possible. I think we are heading towards the end of the corona very soon, and these vaccines will work, and they will work against all different type of strains which are evolving, and probably there is not much of difference in efficacy against different strains, and we hope for the best in the future. Thank you, sir.
Thank you, Naveen, for that very positive message and for creating this extraordinary corona care at AIG. We come to our last message, and this is from somebody again who's very important to AIG, who's been with us for a very long time. Joyce Peterman is the vice president of the Boston Scientific Company. She is, of course, talking from Boston, so it's recorded because it's probably very late in the night there. Joyce, can you have the video of Joyce before?
COVID highlighted is bring healthcare to all and to focus clinical and translational medical research on benefiting patients in socially equitable fashions. The AIG leads by example in all of these areas. I miss you, my friends, in the trenches of research at the AIG, but thanks to COVID vaccines, I will be back soon, as will be so many global researchers. Happy New Year, AIG. Happy 2021 to the world.
Thank you, Joyce. I think we now have our own AIG Marathon Runners. They'll all probably come onto the screen. We have Rakesh, who's done huge number of marathons, Anand Kulkarni, hepatology. We have Bharat Patodia, Rohit Dama, Nitin Jagtap, Adarsh, and Abhishek. Abhishek is our bariatric surgeon, again a very avid marathon runner. You can see that most of them actually are running the marathon now. So they can wish us from wherever they are, just to wave their hand to show us that they are with us here. Thank you, thank you, thank you very much. And I know you're on the field, and we'll get your timing soon so that we can put them up in a chair that we are making. I think as we come to the end of this session, you'll all realize something, that it was actually all these experts who made the day. When we started, when we had so many experts, I'm not sure whether everybody can keep giving messages. But one of the most remarkable things you would have noticed over the last 1 hour is that every single expert gave a different words of wisdom, which was extremely important. Each of them had a different word of wisdom. And I'd sit back, probably I'll go through again and absorb all this a little later when I look at the recorded session of this. But I think this is, I'd like to thank all the experts for coming in this morning, giving us such important messages, and for being so positive about this. I think the vaccine that has come shows us the triumph of science over unknown enemy that was coming in. And I think science has really showed that if it's applied together, it's global, everybody comes together, we can conquer any disease. And this looks very bright for humanity in future. And like as Dr. Somaraju said, we still have to have this warning that future. Yeah.
Can I add something?
Yeah, please. So go ahead, Somaraju.
I forgot to add, at the beginning, we were confused as to what to do, and we are all.
Yeah.
But then, thanks to you and the administration and the whole system, that you created a system and the teams and with knowledge and skills, that they are one of the best in the country to treat COVID and related complications. Even specialists, they moved across their lines and started taking care of patients. And then to the extent, any patient anywhere around Andhra, Telangana area, they just want to come here, nowhere else. Congratulations to all of you.
Thank you, Dr. Somaraju. And as you wisely said, we must be prepared for future pandemic. This is like a training exercise for us, and I'm sure that as we keep getting more, now we are very well prepared for what to do in future. And finally, as we come to the end, I think I want to emphasize again that these vaccines are a product of fantastic scientific research. They're a product of the government agencies, everybody coming together. The adenovector vaccine of Oxford that has been approved, and the inactivated virus vaccine of the Bharat Biotech, both have been approved now by the government. I'd urge that these are safe vaccines. We have had very good experience with this. And of course, mRNA, we don't have still access, but they've been given in Western countries. All of these are safe. I think it's very extremely important that all of us take this, so that we are not only protecting ourselves, but protecting the community against further spread of this. So one has to be selfless and take this vaccine. This is very important. All these marathon things together to come to this grand final, we had a huge crew of staff at the AIG helping us. We're fortunate that we had Capri, who's himself vice president of our institute, himself a marathon runner and is very avid. I think he must have done 10K now for this session. Capri, thank you very much. We are an excellent team of assistants, and especially like to thank our AV people. Robbins has been creating a lot of these digital videos that you're seeing, and I think Satya is a general manager along with Mohan and other AV team has created a fantastic program. We keep getting so many of the pictures now. We'll put it up later for all of you to see. People who have completed different forms of their marathons. And finally, the main architect of this program has been Dr. G.V. Rao. G.V., of course, has this technology ideas where I think all of you know that, and I'll request him to end off the session.
Hi, good morning. Good morning from Hyderabad. Dr. G.V. Rao from AIG Hospital. At the outset, let me thank all the people who have registered for this. Actually, we have a huge registration. If we can just have a look at the screen, actually, it looks like almost about 11,000 people and more have registered for this. It's a huge number for a marathon to be organized. Actually, the Hyderabad runners was envious about this registration that we have had for this virtual marathon. And in fact, it seems to be competing with some of the national, international marathons that have organized in the recent times, the virtual marathons. So it's a very big thank you for all the runners who have registered for this cause from not only from India, from across the globe. Thank you so much for all that. The other thing that made this marathon a big success was a lot of celebrities who campaigned for this, made sure that they passed on the message to the public in general. And we have had a huge response from the celebrities from across the globe who have supported this cause. And I'll also thank all the guests who came this morning and gave very beautiful messages of wisdom that we have to take forward to make sure that we live in a peaceful world and a smiling world, smiling families. We have smiling cities, smiling countries, smiling continents, and maybe the smiling world. Vaccine has come. Actually, we are very fortunate that this entire thing, the campaign, we never thought it will culminate in the government of India announcing the starting a vaccination program in our country. We are very thankful for the entire thing, and we are very glad that the whole thing has coincided with this. I thank my entire team at AIG Hospitals who have been working tirelessly for the last 3 weeks to take this campaign and reach this pinnacle this day. And we have this, you can see this actually, all these people who have been registered, they're sending messages, who have uploaded pictures onto social media for this cause. A big thank you for all these people who have registered from across the globe. Dozens of countries, people have registered for this cause. Well-wishers, thank you, big thank you for all. And again, finally, I thank the entire team at the AIG actually who have been working tirelessly to make this entire event a very successful one. Stay safe, but it is not the end of the answer. Please keep the sanitizing measures on. Please wear the mask, actually, as and when possible, whenever you're meeting. Restrict your travel, restrict in group meetings. Stay safe. I wish you a happy new year. And I'm sure that you'll have a very good news coming in from across the globe and in India. And I'm sure we'll all be COVID-free very soon. Thank you so much once again.
Thank you.